following a short scar only or horizontal vertical thigh lift, the most important thing is that you take it easy and don't do anything that involves pulling your knees apart. Meaning we want to minimize tension on that fresh healing incision. And I need you to do that by not doing the splits, not riding motorcycles, not riding bicycles, not doing anything that involves you spreading your knees apart. The other thing I need you to do is keep that incision clean. If this is the only procedure you had performed, you can shower after 24 hours. I want you to shower with warm soapy water after you take a poop every single time to reduce the bacteria burden on that healing incision. You can go swimming and go underwater after 3 weeks, assuming everything has healed up nicely. You can exercise after 1 week, but in general, you probably aren't going to want to do this because you'd have to do an exercise that doesn't involve a significant amount of thigh or knee movement. So most people do need to wait longer before they can exercise. If you wanted to do, arm curls or something like that after a week, that would be okay. But there's really not a whole lot of exercises you can do that will avoid stress on those healing incisions. Generally, after about 3 to 4 weeks, the incisions are pretty strong, and so you can start to do more and more activity, but let tension be your guide. You will know if it feels too tight, and then you need to slow down and back off. The way that I find the best way to close these incisions and repair the skin to minimize ugly scarring as well as genital distortion involves a few maneuvers. So like I discussed in the previous video, I'll place deep sutures to Colles fascia to minimize the tension on your labia majora to minimize the risk of labial spreading and genital distortion. The other thing I'll do is place deep sutures in the skin followed by a running suture that we need to remove after about 1 week. So I find that superficial sutures and a few staples actually help that skin in that area heal the best, but we need to remove those external sutures and the few security staples within 1 week to 10 days to minimize the suture marks on that skin. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.